Good afternoon, one and all joined here. I, Dr. Felsy Premila and Dr. K.C. Vignesh, presenting here assessment of overall caries risk and mode of birth delivery in children. To start with the presentation, let me share some important key factors. First, the early childhood caries, which is a complex and commonly neglected disease of primary dentition, affecting the quality of life of children below 6 years of age. Dental caries in the permanent dentition as a strong predictor of caries in the permanent dentition. The second is the caries risk assessment, which plays a major role in identifying and understanding the child's early childhood caries risk factors and thereby reducing the chance of further advance of the disease. Among the identified caries causing risk factors in the literature, microorganisms such as mutant streptococci and lactobacillus create an acidic environment and are implicated to be a prime caries causing species for initiation and progression of the decay. Thirdly, the mode of birth delivery leads to the differences in intestinal microbiota of infants and was suggested as one of the plausible risk factor for the acquisition of microorganisms in newborn babies. There are multiple caries risk assessment forms available in the literature that helps the practitioners to follow the preventive protocols by assessing their baseline caries risk. The probability that an individual will develop a certain number of caries lesions or reach a given level of disease progression over a specific period of time, provided his or her exposure status remains the same during the period, is known as caries risk. Any method that uses an individual risk or protective factor to predict caries development or progression is known as caries risk assessment tool or a method. According to the available literature evidences, there's still a controversy between the mode of birth delivery and early childhood caries. Studies have reported that children acquire Streptococcus mutans from mothers through saliva, that is a vertical transmission, and through siblings or caregivers, that is from a horizontal transmission. The C-section alters the ecosystem of the gut microbiota, and infants delivered by C-section inherit microorganisms almost 1 year earlier than vaginally delivered infants. Few other studies described that vaginally delivered babies procure maternal bacterial population naturally as they pass through the birth canal and were found to have elevated levels of microorganisms in comparison with C-section delivered babies. In line with these above discussed points, we found that there were no studies that assessed the caries risk in children below 3 years of age comparing with that of the mode of birth delivery. Why caries risk assessment is important? Because it helps in the clinical decision-making process by fostering the treatment of the disease process instead of treating the outcome of the disease. Second, it gives an understanding of the disease factors for a specific patient. It individualizes, selects, and determines the frequency of preventive and restorative treatment for a patient. And lastly, it anticipates caries progression or stabilization. Few caries risk assessment methods that are available in the literature for assessing the caries risk of an individual are caries management by risk assessment, that is CAMRA, System of the American Dental Association ADA form, Dundee caries risk assessment model, AAPD's caries risk assessment form, My Smile Buddy caries risk pyramid, karyogram, caries risk assessment tool karyogram, the caries risk assessment models of University of North Carolina, University of Michigan's Pediatric Dental Clinic caries risk assessment sheets, caries questionnaire in combination with clinical observations, caries assessment and risk evaluation tests, traffic light matrix, previsor, and DEPA caries risk assessment tools, caries risk assessment for treatment, that is the craft tool, and many other. To assess the salivary bacterial counts, culture-based method, dip slide method, and molecular methods are available. In culture-based method, for assessing mutant streptococci, Mitis salivarius bacitresin agar and Mitis salivarius bacitresin broth are used, and for lactobacillus counts, Rogasa medium is used. And coming on to the dip slide method, there are dendrocult streptococcus mutants and lactobacillus methods. The oracles N, the CRT bacteria from Ivoclar vivarant is available. And under molecular methods, we have checkerboard DNA hybridization, genomic fingerprinting, polymerase chain reaction based bacterial identification, real-time quantitative polymerase chain reaction techniques, and so on. With this broad introduction and background on early childhood caries, mode of birth delivery, caries risk assessment methods, and the forms, we defined our study that aimed to assess the caries risk in toddlers or children with and without early childhood caries using American Academy of Pediatric Dentistry caries risk assessment tool, and secondly to identify the association between overall caries risk and mode of birth delivery in children. To proceed with the study, the ethics approval was obtained from our University Institutional Ethics Committee. We calculated sample population involved children in the age range between 1 and 3 years. Children of both genders were considered for this study if all maxillary and mandibular primary anterior with at least 2 primary molars were erupted clinically. In addition, children who had not undergone treatment for early childhood caries were considered for inclusion in this study. Exclusion being children with medically compromised conditions or syndromes and mothers of these children who are not willing to participate in this study were excluded.
In material methods, the study was conducted in 3 stages. After the study, participant mother or primary caregiver explained about the procedure and consent form was obtained. In registering the participant details, the details of the included participants were recorded in the preformed template by asking orally the child's mother the basic demographic details, mode of delivery, term of delivery. The oral cavity examination is done by one of the investigators of the study, and the caries scoring criteria was made by IGDAS method. In caries risk assessment, American Academy of Pediatric Dentistry caries risk assessment tool comprises of 14 questions, which has been categorized into 3 parameters: 1. Biological factors, productive factors, and clinical findings. In continuation with the previous slide, biological factors consist of 6 questions in which mother or primary caregiver oral health status was assessed using IGDA scoring criteria. The socioeconomic status of the parent was classified using the modified Kupusamy socioeconomic status scale. Other questions were assessed by orally by obtaining the answers from the mother or caregiver. Productive factors, we have 4 questions in which all the answers were circled based on the parent's answer, except for the first one where the guidelines of fluoride vulnerable areas released by Tamil Nadu government 2013 were considered, since all the included participants were residing in Tamil Nadu since birth and the answer has been appropriate. In the clinical findings, we have 4 questions in which the caries status and plaque on teeth of the child was examined in a dental chair by mother or caregiver holding the child in a lying position on his or her lap using a IGDA scoring criteria and the clinical evidence of plaque on the erupted teeth, respectively. As for the third question in the clinical findings part of AAPD CRAT tool, bacterial assessment, mutant streptococci was assessed through the relative quantification using cyber green assay method, and procedure was carried out by placing a passive pipette of 1 ml on the buccolingual surface of the oral mucosa by drawing the saliva fluid, and the collected saliva was transferred to a 2 ml of microcentrifuge tube. The outer surface of the tube was coded, that has been numbered and noted as per the patient ID against the patient name in the demographic form. The bacterial genome isolation followed by the RT-PCR analysis using a specific primers of mutostreptococci was made. Then the samples were stored in the refrigerator. The real-time PCR quantification programming was performed by setting the CT through 4 steps, that is 1. Tag enzyme activation, 2. Denaturation, 3. Annealing, 4. Extension as per the manufacturer instruction. Score has been obtained after the procedure were assessed using RotaGenQ software for bacterial quantitative analysis. The CT value of 15 to 25, greater than 25 to 35, greater than 35 to 45 was considered as high, moderate, low, and circled accordingly in the AAPD form. Some photos of bacterial assessment has been shown. One is saliva collection using Pasteur pipette. 2 is sample with pellet formation. 3 is mini spin prep kit, that is Streptococcus mutans kit. 4 is a tube placement in the well, and last is RT-PCR machine. In statistical analysis, all the analyses were performed using SPSS software. The descriptive statistics were performed for all the study variables, that is gender, overall caries risk, mode of delivery, and term of delivery. The chi-square test was used to compare the categorical variables between the two groups, that is ECC and non-ECC group. The bivariate and multivariate logistic regression analysis was employed to estimate the crude and adjusted odds ratio between the study variables and dependent variables, that is the overall caries risk. In discussion, we suggest plaque on tooth surface, salivary pH, dental anatomy, and white spot lesions should be taken into consideration while assessing the caries risk of an individual. The pH of the saliva and the adequate saliva is also another factor that is required for clearing the sugary foods sticking on the tooth surface. A systematic review by Kritika et al. Summarized few risk factors for developing dental caries, namely diet, presence of dental biofilm, nighttime feeding practices, microorganisms, sugary intake, etc., in which dental anatomy also is one of the significant risk factor in causing dental caries. In discussion, two studies has been documented. One is a prospective cohort study in which Streptococcus mutans colonization was systematically assessed by sampling the children's saliva sample from birth to 4 years of age. In the cross-sectional study, S mutants identification was based on convention culture method, in which one of the main limitation of the study was imbalance between the C-section group of children and the vaginal born group of children. A study by Dominguez Bello et al. Demonstrated that vaginally born delivered children, as they pass through the birth canal, they naturally acquire a variety of maternal indigenous bacteria, whereas if the children born through aseptic manner or atypical microbial environment through C-section, there can be a chances of acquiring high risk of microorganisms. Despite the recent study reported that parent oral health perception and social behaviors significantly affect the oral health related quality of life of their children. Significant connections have been happened between the maternal influences on children's carcinogenic bacterial colonization and caries status. Future studies are needed to explore and advance our understanding of the possible biological mechanism underlying the mode of birth delivery in relation to the colonization of carcinogenic microbiota and development of ECC. In conclusion, based on the overall caries risk assessment, our study reports conclude that proportion of high-risk subjects was significantly more in non-ECC group of children than the ECC group, and the children born through C-section are more prone to be high risk than the children born through vaginal mode of delivery. Though our study results were contradictory with the published literature evidence, however, we conclude saying that change is the only thing that never change. In acknowledgements, This study manuscript is currently under review in EAPD journal. This study was supported by the intramural research grant known as GATE, that is Growth and Advancement Towards Excellence, from Sri Ramachandra Institute of Higher Education and Research. I thank the entire team for the help in completing this project. These are my references. Thank you all for your kind attention.